Hi there, my name is Steph and I will be taking you through a presentation today that explores the community development approach in health promotion. We will begin by looking at what community development is, its history as a health promotion strategy in Australia. Then we'll quickly explore a case study. Following this, we'll discuss some of the barriers and challenges that the community development approach presents for health promotion practitioners and the importance of learning the skill this approach offers for future health promotion practitioners working in the field. So I'd just like to start off with what is not community development. It's a funny way to start, but I think it will help us deepen our understanding of the approach as we go through the presentation. So community development is not a one-off event, definitely not government agenda-driven programs with a trickle-down or top-down approach. It's not exclusionary practice, and it's not about keeping power between a few people. Moving on, how would you define a community? So this is a pretty contentious topic and it's differed depending what context you're in. But here I've included two definitions. There are only two offerings and it's important to note that definitions will change and morph depending on the community you're working with. Well, what is community development? So it's a new approach in health promotion and it's relatively new in the way that they approach issues of inequity in health access. The basic notion defined by AIFS pertains that community development is a process where citizens are supported by agencies or organisations to identify and take collective action on issues that are important to them. So in basic terms, it's about having a holistic approach which is grounded in multiple theories and principles, and these theories and principles are coined by renowned CD or community development workers like Susan Kenny or Jim Ive, and these include things like empowerment, human rights, inclusion, social justice, self-determination, and collective action, all these buzzwords that you hear getting thrown around the community sphere. So we're going to have a quick look at the history of community development. CD has its origins in Australia from the host of reform programs that came out of the Whitlam Labor government. It was definitely a representation or a revival of the post-World War II in Australia. Multiple programs and initiatives at a federal and a state level were introduced and they lend a hand to the notions of community development. He was very well known for really introducing community development in a political arena. So just a quick notable mention was the program Community Health Program, which was instated in 1973. It aimed to provide a range of primary healthcare services which had an emphasis on prevention, counselling and rehab. But the point of difference that really had not been explored in the health promotion space yet was that the CHP intended to provide an alternative to costly and hospital institutional care, really bringing it back to that community and that community care level of rehabilitating people and integrating them into society and leaning them in on their community supports, which will work within that social determinants framework that's influenced by the Ottawa Charter. So quickly looking at some of the principles of community development as a health promotion approach. These 6 come from the textbook by Verinder and Talbot, and I'm going to go through the value and needs for these principles. So community development stems from a social model of health, which is derived from social determinants. It is concerned with the relationship between health outcomes and socioeconomic outcomes and understands that the unequal distribution of health is related to the psychosocial and physical conditions of an individual. People have the right to define what health means to them, to act in the interest of their own health, and to have control over the decision-making processes that affect their lives. And this is a really important one, those who experience disadvantage know most about their condition, and that knowledge should be valued. It's very vital that local knowledge cannot be underestimated. The involvement of these groups is crucial in not only identifying the issue, but also understanding the underlying cause of the health issue. And this comes down to the importance of understanding community development and its principles in working with a holistic view. The community development approach suggests that a grassroots approach to health improvement is the most successful way to improve health outcomes. And what we'll look at further in the presentation is that the nuances of a grassroots or bottom-up approach is often one of the bigger challenges that a community development worker will face. So now jumping forward to my case study, I've chosen the national organisation Headspace, and many of you will be aware of this organisation. Headspace is the National Youth Mental Health Foundation, providing early intervention mental health services to young people aged 12 to 25, along with assistance in promoting young people's well-being. So that's a direct quote from the definition, a direct quote from the website defining what Headspace does. But I chose this organisation for many reasons, but mostly because of their program design, and the consultation process they use to inform the work that Headspace does. So I'm going to go through a few things that Headspace does that is very explicit community development, and then we'll go into some other programs that they deliver. But most explicitly is probably their Headspace community centres that are the most well known when you think of Headspace, and they're these youth-friendly community centres that young people can come in. It's a soft entry point and they can seek mental health assistance. They're often made up of multidisciplinary teams of GPs, psychologists, social workers, youth workers, counsellors. And the entire building is designed by young people. So it's just a perfect example of what a community development project can do and how it can be successful. The other really unique feature of Headspace is they have this online platform called eHeadspace, which is an online and telephone service that supports young people and their families. The online platform offers confidential support via phone or an online forum. And the other really unique feature is that they have this online forum that young people can form relationships and share in each other's struggles and really foster that sense of online community. And for a national organisation that is completely federally funded, it does an incredible job at implementing effective programs that are aligned with its core aims that ultimately lie within a community development framework that looks at changing things like discourse, culture, language, and really tackling that destigmatizing issues around mental health. This encourages help seeking, and it builds resilience in young people. And I wanted to touch on how did they get this good? Where did they come from? And looking at the history of Headspace, because I think it's important to understand how Headspace came to be and how it sits within this approach. So a few things occurred in the health landscape, one of them being a shift in community attitude, another one being a shift from hospitals treating issues like anxiety and depression and moving that to like a community sector issue. And there was a rise in government interest, so it became a political issue. This attitude change rose a question, and the sector was asking themselves, do we have a health system that can respond to the challenges of mental health problems with young people aged 12 to 25? And the simple answer was we didn't. There was lots of gaps. Headspace was born from this, and it's now seen to have been a program to fill that gap. And its main goal is to capture young people when they first present problems or are first in trouble. During the Howard government of 2004, there was a heightened interest at a political level in mental health, and what leveraged the issue further was the community sector engaging in their own groundwork, namely the introduction of Beyond the Blue and people like Pat McGorry, who were really pushing the conversation. One of the biggest changes in government was in 2001 when they introduced funding of psychological services through the program Better Outcomes Scheme. And this just allowed for more people to have access to psychological services. But when they reviewed it, they realised that only people middle-aged and older were accessing it. And as we know now, issues like depression and anxiety often present themselves in adolescence. So there was a big gap in offering support for this age group. So from this broad level national conversation around mental health, Headspace was born, and in it, community development is rooted very deeply at the core of Headspace's framework. So they did this through very thorough and methodical consultation with young people. They knew that young people with a lived experience of mental health, who were going to be their consumers, were seen and valued as the people who knew the most about their lives and the issues that affect them. So they were central to every stage of the design and implementation of Headspace at a national level. This framework extends to all Headspace centres and local centres. Although there's argument that some centres do it better than others, it's not to go without saying that a federally funded organisation fueled by a national agenda sitting within the state, it manages to overcome many of the barriers and challenges that we're about to touch on. So just finishing up the case study, I wanted to touch on two other programs that Headspace does, and one of them is called the Headspace Consortium, which is a partnership between multiple national bodies that work in a few different key components. Some are a national training program for professionals. Some of it includes a community awareness strategy or creating an evidence-based resource platform. All of these are intended to lead to better access or ultimately better outcomes. And then from the consortium leads into this thing called the CYS, or Communities of Youth Services, which is a model that focuses on building the capacity of local communities to help them identify at early stages mental health problems and be able to effectively respond. This model encourages genuine reform and importance on planning and local implementation of community awareness campaigns. And ultimately, with the consortium and the CYS together, its main goal is to mobilise the community sector, thus strengthening its response. Many young people are reluctant to access public mental health services due to the concerns around the stigma, and Headspace, with the consortium and the CYS, aim to make all of their centres and services a place that is a soft entry point, which they've found is more accessible and more effective in attracting young people to the service, increasing help-seeking behaviour, and in the long term, engaging them over a long amount of time. Now that we have briefly explored what community development is and what it looks like in the case study, we're going to look at some of the challenges and barriers a health promotion worker would face working with this approach in the industry. So the first issue I'm going to present is where and how community development in Australia exists within this health framework. So in today's modern society, we know we're governed by a state that has neoliberal values, and as we know, in itself poses many barriers to health equity and access, but in direct relation to community development, neoliberalism exists in a dichotomy with the health promotion approach because of its opposing core values. Neoliberalism values individual responsibility with little to no onus on the government, whereas on the opposite side, community development, values social justice, moving away from that welfare state and a place where communities can be self-sustaining and making decisions for themselves. So the way institutions and government bodies are arranged have created barriers for communities to express their collective voice. So these arrangements often fail to meet the true needs of a population, and often the resolution simply lies in altering that relationship, but it's often a lot more challenging than that. It's about shifting a power relationship. So the dichotomy presents significant obstacles for a public health practitioner to work in, because not only are you up against a state system that works independently in silos, but also against a machinery of governing power that systematically oppresses grassroots change. So activating or encouraging that bottom-up change that we've spoken about, which we know lies at the absolute heart of community development, it's an ever-increasing uphill battle. It'll be continuous effort of encouraging, empowering, and validating a community's worth to encourage that challenge of behaviour or to work independently. So just going to move on to the second challenge, or what I like to call, the politics of community development. Community development is inherently political or bureaucratic, and it's often its biggest challenge. So what we're going to look at is, I guess, the rhetoric or the discourse of community development, because what you'll find is theory often doesn't reflect the reality of practice. I've included a quote here on the screen by a German philosopher. This quote is very true, not just for the work of CD, but any aspect of professional life demands this level of grounding theory to inform practice. But the reality of working in this approach is often contrary to the theories that you read and what you expect the outcomes to be. And the funny thing is that community development is not always outcomes based, and tangible results can be hard to measure when working on projects that are defined by the population. So this poses issues whilst working in a state-governed society that is going to require you to meet criteria or meet benchmarks or meet funding arrangements or reporting dates or KPIs, and sometimes you're just not going to have that information, or the community development work that you're involved in is just not going to behave in that way. So what many practitioners find is that the community development discourse is highly nuanced. So community development conceptually is an approach that should work, and the discourse holds these strong romantic overtones, which makes it an appealing strategy. But the reality of practice is unmatched by the literature. For example, literature surrounding this approach explains the importance of changing or shifting power relations within a population to achieve greater control. The reality is, unfortunately, it doesn't always work as anticipated, or the struggle is not worth that small outcome. And this is for a number of reasons, but drawing back to that issue of projects in Australia often exist because we live in a state that's run with neoliberal values, and it's to a degree often still a top-down approach. So quickly drawing on the textbook's view of community development projects often sit within three different approaches, those three being the authoritarian approach, the paternalistic, and the partnership. What you'll find is most projects sit within the first two, which hold those neoliberal values, where an outsider sees an issue, imposes change. What you'll find the most successful is the partnership approach, which assumes the members of the community at hand have the most knowledge and expertise of their own lives, and the process of involving them in the decision-making process is just as important as the decision or outcome itself, and Headspace is just an excellent example of this. So we've spoken a lot about the negatives of having a neoliberal society, but having a state that is governed from a neoliberal space, despite dwelling on its negatives, it's somewhat a positive because it pushes that impetus for community development and the need for social change and grassroots work. So we're going to have a quick look at some of the opportunities. So just although those barriers we've just spoken about, they might seem like big and wicked problems to overcome, it's not to deny that the value of community development programs and the role a health promotion practitioner plays in this process are of great benefit to populations. I'd like to make a point that despite some community development efforts in the past have failed to deliver on what they've promised, the underlying ideals and overarching aims are still completely relevant and shouldn't be abandoned. Because at the end of the day, they are what continues to motivate the push for a fairer and equitable society where all populations have equal access to healthcare. So you're probably asking yourself, why would a health promotion practitioner need the skills in this community development approach? What are the benefits? Where to go from here? So regardless of what type of workplace or environment you find yourself in, the skills and the attributes that you can employ after coming to an understanding of community development will enrich and further develop your capacity as a health promoter. I've listed a few skills that have been taken from the textbook, Promoting Health. This will give you some of the insight of what's required to undertake this type of work. So you can see communicating effectively, building consensus, managing conflict, social enterprise, which is an interesting one in the re-emergence of community development recently. You'll hear a lot of collaboration or partnerships and different organizations trying to do work together. I think it's really important also to note the difficulties of exercising or employing these skills or acting in these roles when faced with the limitations that we've spoken about. During the community development process, you'll most likely have to work with people from government or institutions or organizations, and you have to be able to manage their different perspective and in particular the language that they speak. These people don't always understand the primary healthcare approach that we have coming into community development. It's important to not get disillusioned when you realize the government may have little regard for community development's principles like empowerment and increased community voice, because as a health promoter, you can't afford to be disenfranchised or lose sight of the core values of community development. It's just about working realistically and optimistically, but also recognizing the community development approach's limits that it holds, but also the strength and potential. So in summary, you have to learn to manage your expectations personally and professionally, but on that wider level, because it's vital to working successfully. So in summary, what we've done today is we've looked at the importance of community development briefly, what it looks like in Australia and some of its history. We looked at the case study of Headspace, which helped us understand some of the barriers and limitations that we work within when working with this approach. And we had a look at some of the skills and roles and why it's necessary to have these skills in your toolbox as a health promoter when you're working in the field. My references are on the next 3 slides. Thank you for watching today. I hope you enjoyed.